Hello, dear students. Today we will discuss not on a particular topic of pharmacology, but we will discuss about the questions of both theory as well as practical topics of general pharmacology with explanations. Here you can see the first question: match the following different drugs are there as well as the sources from which these drugs are derived are also there. Now, so the digoxin, it is derived from the plant source, that is foxglove. So the source is plant. Then the penicillin is an antibiotic, and as the definition of the antibiotics are the drugs that are derived from the microorganisms and they are acting against microorganisms. And you all know that the penicillin is a chance discovery from the fungi. So the answer is microorganism. Then the next is liquid paraffin. It is obviously derived from the minerals. And hepatitis B vaccine, these are the agents which are derived from the recombinant DNA technology. So the answers are digoxin from the plant source, penicillin from the microorganisms, liquid paraffin from the minerals, and hepatitis B vaccine by the recombinant DNA technology. For that explanation, study of the genetic basis for the variation in the drug metabolism. This is known as a pharmacogenetics, and when we use this information for the selection of the particular drug, that is known as an individualization of the drug therapy, that is known as a pharmacogenomics. So don't confuse with these two terms, pharmacogenetics and pharmacogenomics. Now the second is genetically determined abnormal reaction to a drug. The reaction to a drug is totally different as that from the other individuals, and here the reason is the genetic makeup of the individual is different, that is known as an idiosyncrasy. Then immunological mediated reaction to a drug, it means the hypersensitivity. And last, as I told you, that usage of the genetic information for the selection of the drug, that is known as a pharmacogenomics. So the answers are as follows. I am not again repeating this. Then the third question, followings are the advantages of intravenous infusion except. So in this type of the question, here I have mentioned this except in a capital letter, but many times it is not there. So read the question very carefully. So here there are different options, and out of these one is incorrect. So we will go one by one. Rapid administration purpose is that when we want a smooth plasma concentration for a prolonged period of the time, or we want to administer the larger volume of the drug, then we are using the intravenous infusion. If we want to administer the large amount of the drug, and you can call it as when you want to administer a rapid introduction of a drug for a immediate onset of action, then it is known as a bolus. So here you have to identify the incorrect statement, and that is the first one, because the maintenance of the constant plasma level for a prolonged period of the time, it is true. Administration of large volume of drug, it is also true. So the incorrect one will be first one. Here you have to identify the correct statement. Which of the following is correct in regards to the intramuscular route of drug administration? Large volume of the drug can be administered? No, we can administer up to 10 ml. That is not considered as a large volume. Suspensions and colloids can't be administered? No, we can administer that. Onset of the action is rapid as compared to subcutaneous and intravenous route. Onset of action is rapid as compared to the subcutaneous, but definitely not as compared to the intravenous route. So all the above three statements are incorrect. And absorption from the intramuscular route is not always faster as compared to intramuscular route is faster as compared to the oral route, but not always. There are many exceptions, and that's why the correct answer is first three are incorrect and fourth is correct. Now, these are the type of the question in which you can select more than one correct answer. So the advantage oblique advantages of sublingual route of drug administration is oblique R. We'll go one by one. It can be employed in patients who are having vomiting. Yes, because the drug is crushed in the mouth cavity and it is directly absorbed into the systemic circulation. Patient does not have to swallow the drug. Once the drug is taken by this route, its action can't be terminated. No. Once the patient spit out the drug, its action can be terminated. Bioavailability is nearly equal or even more as compared to the intravenous route. It is equal, agree, but it is not more than the intravenous route. And inactivation of the drug from the liver is bypassed but not from the intestinal wall. Yes, the primary purpose for the sublingual route is the rapid onset of the action because of the bypass of the first pass metabolism, but in the both, in the liver as well as the intestinal wall. Okay, and that's why the correct statement is only one, and that is the first one. It can be employed in patients who are having vomiting. Now the drugs is not going to be absorbed. Okay, so it is very obvious that if the drug is lipid soluble or somewhat water soluble or both solubility, the drug is going to be absorbed. But if the drug is neither lipid soluble nor water soluble, they are not going to be absorbed at all from the gastrointestinal tract, and they are used for the diagnostic purposes also. So the answer is the last one, neither lipid soluble nor water soluble. Then which of the following factor or factors is or are increases the bioavailability of a drug? We will go one by one. When the gastrointestinal transit is increased, so the contact time for the absorption is reduced, and that's why the absorption and bioavailability will be reduced. Major gastrointestinal resection, when the major amount of the GI tract, especially the small intestine, if it is resected, again the surface area reduces, and that's why the absorption and bioavailability will be reduced. We have discussed in the previous question, first pass metabolism, it will reduces the bioavailability of the drug, and the last one is enterohepatic recycling. It means that the drug is absorbed, then the drug enters through the peripheral circulation, and for the metabolism it enters into the liver. In the liver again the drug is metabolized, conjugation occurs, then again it is released through the bile into increases the net amount of the absorption of the drug and hence the bioavailability of the drug. So the correct answer is only one, and that is enterohepatic recycling. All other factors that reduces the bioavailability of a drug. Volume of the distribution. You know that the lowest volume of the distribution will be there if the drug remains only in the vascular compartment. And which drug remains only in the vascular compartment? The drugs that are strongly bound to the plasma protein, so they cannot cross the vascular barrier. So the answer is strongly protein bound drugs. Conjugation of the chloramphenicol is an example of. Now here you may be think that okay, here I have to read in detail about the how the each and every drug is metabolized by which process and what will happen to the drug, then and then I can give the answer. That is true, but if you just think logically, that conjugation is a phase 2 reaction, and in the phase 2 reaction the drug is going to be inactivated. Fine. And chloramphenicol is an active drug. So the answer will be inactivation of the active drug. Okay. Then facilitation of the pharmacological response by concomitant use of two drugs. It means that when you are using the two drugs, is more than 2, not equal to, and that's why it is known as a synergism. Then therapeutic index is very easy. Therapeutic index is a measure of the safety of the drug. It is calculated by dividing LD50 upon ED50, and more the therapeutic index, more the safe will be the drug. So many a time students are having confusion that whether it is LD50 upon ED50 or ED50 upon LD50. Just you have to remember that more the therapeutic index, the more the drug will be the safer. It means that the numerator should be more and the denominator should be less. Okay, now if the numerator should be more, so the LD50 is more, it means that significantly higher amount of the drug is required to kill the test population. So obviously it should be higher. And ED50, that is denominator, the amount of the drug that is required to be effective in the 50% of the test population. Obviously it should be very less. Okay, and that's why if the ED50 is very less and LD50 is very high, then and then the drug is considered to be safe. That's why always in the numerator the LD50 will be there and in the denominator ED50 is there. Then identify the correct statement or statements. We will go one by one. Type B adverse drug reaction is dose related. No, it is not dose related, and that's why it is called the bizarre. In some individual it is seen in a very low dose, while in other individuals it is not seen at a very high. Reaction is dose related, augmented, more common, but fortunately the mortality is less. Type B adverse drug reaction has a low incidence as well as the low morbidity. Type B adverse drug reaction, as I told, it is not dose related, bizarre, and its incidence is less. And now here you have to understand, when the type B adverse reaction occurs, the mortality it will be definitely more as compared to the type A, but morbidity is less. So the answer is C. So C is correct. Now we have to check another one. Type B adverse drug reaction is pharmacologically predictable. No. Type A is predictable. Type B is not predictable, and that's why it is called the bizarre. And the correct answer is C, that is type B adverse drug reaction, has low incidence as well as low morbidity. Therapeutic drug monitoring. Monitoring of the plasma concentration of the drug is required in drugs with high safety margin. Obviously, no. Dose cannot be correlated with the clinically measurable parameter. That is true, because if you can correlate it with the clinically measurable parameter like the blood pressure or blood sugar, then you will definitely check that rather than you monitor the plasma concentration. So that is correct answer. Hit and run drug. Obviously no, because the drug still produces the action but in the plasma it is not there. And the prodrug means the drug it is activated inside the body, again it is not helpful. So the answer is B. Identify the correct sequence of onset of action, fastest to slowest of the receptor mediated action. Now you don't have to so much panic about such type of the question. You just understand the principle. Which type of the receptor is having fastest onset of action? When the drug directly binds with the receptor and these receptors are itself incorporated the ion channel, so immediately the channel opens and closes and then it produces the action and its actions in the milliseconds. So the fastest acting will be ion channel receptor, and the slowest action, it means the drug acts through the receptor, then it will lead to then the transcription, then translation, then the synthesis of the protein, and depending on the type of the protein it produces the action. So the slowest will be receptor regulating gene expression, and GPCR, it will G protein coupled receptor, it will be within these two. So the answer will be fastest is ion channel followed by G protein coupled receptor, and the lastly receptor regulating gene expression. Now in non-competitive receptor mediated antagonism, what will happen? That here you have to understand that whenever the antagonism there is a rightward shift, okay, but in non-competitive antagonism, even if you increases the concentration of the agonist, you cannot surmount this antagonism, and that's why the effect H, but flattening of the dose response curve. So the answer is rightward shift and flattening of dose response curve. Now arrange the phases of the clinical trial according to the number of the study participants, lowest to highest. Okay, so here you should know the phase 1 clinical trial, it is to be done in the healthy human volunteer. It is in the 30 to 40. So it is in a 2 figure. Phase 2, it is done first in the patient, and here the number of the study participants are 100 to 300 or 400. So it is in a 3 figure. Phase 3, it is in a even more number of the patients. You want to establish the safety efficacy, it may be multicentric, so the number of the patient is in the thousands, so 4 figure. And phase 4, these are the post marketing studies that are to be conducted once the drug is approved, so maximum number of the patients are there in phase 4. So here you have to write from lowest to highest, so the correct answer is phase 1, then phase 2, then phase 3, then phase 4. A female has developed a genital tract carcinoma at the age of the 58 years. It was found to be due to, when the female has been investigated, it was found to be due to her exposure to the oral contraceptive pills. She had taken the OC pills for 10 years in her reproductive period. Okay, and then he stopped the contraceptive pills, but now she developed the genital tract carcinoma. So this is a delayed type of the adverse drug reaction. It means that The exposure of the drug is there, but it is in the past, and after some time the patient develop adverse reaction. So here the answer is type D, adverse drug reaction. So identify this. Here it is, the answer is written in this image only, because if you just look at the top, it is mentioned that it is for the use of the registered medical practitioner only. It is a package insert. Okay, it is not label, it is not drug monograph, it is a package insert, and it is to be meant for the registered medical practitioner or the healthcare professional. So the answer is B. You should be very clear about this concept. Package insert is not meant for the pharmacist or for the patient, but it is for the healthcare professional only. Yes, identify the type of the adverse drug reaction. Okay, here you can see very clearly that there is a deformed nose as well as there is a cleft lip. So it is an structural abnormality due to the exposure of the drug during the pregnancy. So it is known as a teratogenicity. So the answer is C, teratogenicity. Yes, what is the shelf life of the drug shown in the given picture? If you look the picture carefully, the shelf life of the drug, you have to start with the manufacturing date. Okay, so it is from the November, and you have to calculate up to the expiry date. So if you totally calculate from November till next November, so it is 2 years, so 24 months. So here the concept is, how will you calculate the shelf life? When you find the difference between the manufacturing date and expiry date, and both of these two are given in a label, and hence it is called, if you look at it carefully, you have to start with the December 2012, so you have to include that month, December 2012, and up to November 2014. Okay, and that's why the answer will come 24 months. Okay, identify the type of the tablet. Here you can see that from the figure. Now there is one another way which is not a very good way. So you can eliminate the incorrect answer. It is a sustained release tablet. No, the drug is immediately released, so it is not sustained. It is scored. No, it's not scored. Then it is entry coated. No, you cannot come to know that the coating is there. Effervescent tablets, yes, immediately the drug is to be dissolved in a liquid, in a water, the drug particles are released, and that's why the answer is effervescent tablet. Then yes, here you have to understand the concept of the efficacy and the potency. The maximum achievable therapeutic response, it is called the efficacy. So in the figure it is very obvious that there are 4 drugs, even though there are 4 drugs, but the maxima is equal. So A, B, C and D, these are equally efficacious. Now for producing the same action, the amount of the drug required, if it is less, then the drug is considered to be more potent. So more the graph is on left side, the more will be the drug potent. So A is the most potent, followed by the drug B, followed by the C, and followed by the D. Okay, so the answer will be the drug B and the drug D, that are equally efficacious. Yes, all the drugs are equally efficacious, but drug D is less potent than drug B, because the drug D, DRC, is on the rightward side than drug B. Okay, so the two concept, one is the peak that indicates the efficacy, and second is left or right. If a drug is on the left side, it means that it is more potent. The right side is less potent. Identify the device or the dosage form. This device is a nebulizer. Okay. And then last, you may be panic by just go through that it is a very long exercise, but no, it is a very simple. A patient suffering from malaria is unable to retain the chloroquine orally, and you want to give the drug by the intramuscular route. So from here the statements are important. Dose of the chloroquine is 3 milligram per kg and the weight is 40 kg. So the total required dose is 3 multiplied by 40 is equal to 120 mg. Now the availability is 40 milligram base per ml and we require 120 milligram. So we total require 3 ml. So the answer is 3 ml. Okay. So this is all about the questions of both theory and practical of the general pharmacology. Please share your comment about the questions and whether it is going to be helpful to you. Okay. And if you have yet not subscribed the channel, that is Pharmacology in Simplified Way by Dr. Darshan Dave, please subscribe it. Thank you very much.